New medication and technologies enable women to live longer. Well, they now have more issues to deal with when it comes to their eyes, such as cataracts, glaucoma, and at times the diagnosis can be even worse.
One thing that I see a lot of here in the clinic is macular degeneration in women, especially as women are living longer. Everyone's living longer, but especially women.
It's no secret that women put their family first, but when it comes to eyesight, professionals say you need to make yourself a priority.
A lot of things are time sensitive. Now, for just, a young, healthy woman without medical problems, if you don't have diabetes, you don't have high blood pressure, you don't think you need glasses, I'd say maybe an every 2 to 3 year exam. But we screen people, anybody with diabetes, which is especially common, gestational diabetes, can get worse during pregnancy, and so we see those people every year.
As Dr. Margaret Carter said, pregnancy can influence your eyes, something she herself struggled with.
You'll have a spot where you can't see out of, it's called a scotoma, and then over about a 20-minute time period, that spot will enlarge and travel over to the side of your vision, and then it will become maybe like waves or jagged glass around it, and then it'll go away. And then some people get a migraine headache after that, or just a plain headache after that.
It's not uncommon for vision to change while a woman is pregnant. Sometimes they can even become nearsighted.
But there's something about the hormones, it can just trigger things like that.
Carter said if anyone notices any vision changes, they should immediately check in with an optometrist. Dr. Carter says many times vision changes can be an easy fix or just go back to normal on their own. Even more reason to seek care early. For HealthLink, I'm Amity Adrisi.